The following special presentation of your Hometown Health Connection Community Conversations focuses on the Child Advocacy Center, CAC, a program of Best Self Behavioral Health. The show is presented in partnership with WBBZ-TV and Buffalo Healthy Living magazine with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, Best Self Behavioral Health. Hello, I'm John DeSciullo. Children's Advocacy Centers, CACs, are community-based, child-friendly organizations that coordinate a multidisciplinary response to allegations of child abuse. The CAC in Buffalo brings together in one location child protective services, investigators, law enforcement, forensic interviewers, prosecutors, family advocates with a mental and medical health professional, providing a coordinated comprehensive response to victims of abuse. CACs provide a safe, neutral environment for children and their families where the child's well-being is a priority and where children can speak to a forensic interviewer who is highly trained to understand child development and therefore able to interview the children, particularly at that critical time. A multidisciplinary team approach like this results in better outcomes for child abuse investigations. Now, we have some statistics for this show because we're going to highlight child abuse, bringing attention to the youngest and most vulnerable individuals in our community. And it's really important in Erie County. Would you believe we have the second highest rate of reported child abuse in all of New York State, with more than 3,000 cases of child abuse each year? Astonishingly, 1 in 10 children in our community will be sexually abused before their 18th birthday. And in many cases, it is silence and secrecy that allows the abuse to begin and continue. It's time for us to speak up for these children who can't speak for themselves. Let's meet our guests. Dr. Iram Ashraf is a board-certified child abuse pediatrician, medical director for Child Abuse Prevention Services, and a clinical assistant professor in the Department of Pediatrics of the Jacobs School of Medicine and Biomedical Sciences. Lieutenant David Mann has been lieutenant in the Special Victims Unit of the Buffalo Police Department since 1995. The detective unit is responsible for investigating sexual assault, intimate partner violence, child abuse, elder abuse, sex offender management, human trafficking, and the Juvenile Bureau. He's a member of the boards of the Best Self Behavioral Health and the New York State Children's Alliance. Rebecca Stevens is director of the Child Advocacy Center at Best Self Behavioral Health, and she's a former program supervisor of crisis services. And our friend Dr. Stephen Turkovich, president now of Oshai Children's Hospital, and continues as chief medical officer there as well, where he leads the hospital's daily operations, clinical and support services, community physician relations, off-site pediatric and obstetric primary clinics. He is a leader in advocating for children and families in our community as a trusted medical expert who works tirelessly to collaborate with organizations throughout Western New York to positively impact the health and well-being of our community. So Rebecca, we're going to start with you on our second program for this very important topic. Of the 3,000 cases that we talked about in that statistic of child abuse in Erie County, reflecting, which is unbelievable to think, the second highest rate of such abuse in all of New York State, why is it that only 1,000 children can be seen? And what happens to the other 2,000? Let's talk about the role that Best Self Behavioral Health is currently doing to increase that capacity for care in children at the CAC. And then, of course, this current capital campaign to move this whole project forward.
There's a few things. One, just so our viewers don't think that there's an epidemic that's unusual. While this is the second highest rate of child abuse in New York State, those numbers are similar to everything else. Buffalo is the second largest city, so population-wise, these are numbers we expect to see. Okay. That 3,000, just so you know, also takes into account by statistics, the number of kids who aren't reporting. So it's the kids that are coming forward, but also the numbers that we know that are out there that aren't coming forward to get the help that they need. So what we've been talking about doing is building this new CAC that will reach that capacity. So any child, we're going to encourage children to come forward to get the help as soon as possible, and they'll be able to get it at our new building at 899 Main Street on the medical campus, which will have enough space for 8 therapists, 4 medical exam rooms, 4 forensic interview rooms, space for all of our partners to be co-located and really working together in one facility, so that any kid at any time can come and get help.
Do children come to you out of the blue? If they know of this facility? Or is it generally an adult that brings them forward?
What surprised us recently is we've been doing a lot of community education in schools and talking about child abuse and telling kids that if this is something that's happening to them, they can ask for help, and we want them to. And it's been amazing to us how many children are heeding that and coming up to our community educators right in the schools and saying that they do need help and help is available. Most typically, they're reporting to a teacher or to another mandated reporter who's reporting it to law enforcement or CPS. Oftentimes, though, we will have family members that'll call and say, my 14-year-old just disclosed to me this happened many years ago. They don't want to report it to law enforcement, but they're interested in getting counseling because they're having symptoms, and those types of things we can deal with as well.
Symptoms, or maybe they don't want to make mention of it.
Absolutely.
Yeah. Let's bring in Dr. Ashraf on that point. What are the reasons parents or caregivers may not want their child evaluated medically at the CAC? I mean, how would you address that? Are they trying to hide something, or maybe they just don't understand it? Or maybe they're listening to the adolescent that says, there's nothing wrong here. How do you address that part of it?
So I think the most common concern or anxiety that parents or adolescents have regarding a medical exam at the CAC is that they believe that the exam is going to hurt or that it might be invasive. So we always assure children and their parents that the exam is completely an external exam. We walk them through every part of the evaluation as we're doing it. We let them know that they can decline any part of the exam that they don't feel comfortable with. We also reassure families and children that the purpose of the exam is really to make sure that their bodies are healthy. And after the exam, when they get the reassurance that they are healthy, there's definitely relief on part of the child and family. And we hope that that helps families and children primarily process their trauma. But to answer another part of your question, there is the possibility of a more complex familial issue, for example, generational trauma or preconceived fears in general regarding medical evaluations, abuse evaluations, or the possibility that abuse has happened. These things can certainly hold families back from agreeing to do a medical evaluation with us. But when we do explain to them the real goal of the medical evaluation and the potential benefits, families and children most oftentimes agree to do it.
How do you address a situation where the child may say, I want the evaluation, and the parent says no? Who gets the nod there?
So it depends on the age of the child. So if the child is a mature minor, and typically it's 12, the age of 12 and up, the child has the right legally to make their own medical decisions regarding healthcare and sexual healthcare. When children are younger, it is really up to the parent whether they want to do the exam or not.
Interesting, that age of 12. Lieutenant Mann, you've been doing this a long time. Thousands of cases, things that you've seen, I can't even imagine. How do you process this? Is there a point where you grow numb to what you see, and how do you heal yourself mentally when you're dealing with this?
Well, first of all, everyone who does this kind of work has to find a way to deal with the content, or you don't last very long. But the thing I want to point out is that I'm a supervisor, and so I'm overseeing investigations. It's the detectives, the child protective services workers, the forensic interviewers, the physicians, the nurse practitioners, the nurses. They're the ones who are dealing day to day with the individuals, the families, and the stories. And everyone has their own way of coping in this line of work. I do a lot of running. There are other runners in our group at the CAC, but you definitely do need to take care of yourselves, and we have to take care of each other in order to stay in this kind of work.
I would think almost sometimes you become personally connected maybe to some of these stories. Do you ever keep in touch with some of these families, with some of these children as they grow out of their problem or their abuse?
It's atypical. It does happen from time to time, but I think that we're, as a team, we're there for people when they need us, and when we've helped them through it, each in our own role, that we're fond memories of a terrible time, but that people tend to move on.
Dr. Turkovich, you have young children. What do you teach them to keep them safe? And what advice would you have for parents and grandparents and caretakers who are watching on how to keep their children safe and what to look for, whether it's being safe from predators or being safe on the internet and technology?
Yeah, I think that's top of mind for every parent. In the pandemic and the amount of time that children spent online and continue to spend online as a result of the pandemic makes it even more challenging and top of mind. The first thing I say is you want to create a safe environment for them to be open and honest with you. So keep those lines of communication open with your children, even at younger ages. As they learn about their bodies in school, talk about it and talk about them in age-appropriate sort of ways. I know many schools teach children around recognizing a predator and the fact that that's not okay. And so when they're having those lessons in school, talk about them at home. Teach your children that you are comfortable having those conversations so that if something were to happen, they are comfortable to come to you. The other thing is parents know their children best. So be on the lookout for any cues and changes of behavior. Sometimes a child may become more withdrawn or may become more angry or be acting out. And have those conversations with them to really understand what's happening. When they're going online, know what they're doing. Make sure you use all those parental controls as much as you can. Proactively tell them that do not talk to anybody if you don't know who they are. Don't talk to a friend of a friend because you don't know who they are. Ideally, they're not socializing on the internet, but we all know that kids now play games with Fortnite and Roblox and all those sorts of things, and that's the way they socialize. So you really want to make sure that they're doing that in an area in the home where you can observe and you can watch. They're not, closed away in their bedroom. You understand what they're doing. You proactively ask them if they have a phone or if they have another way to access the internet in addition to parental controls. You're monitoring that, looking at that every day. Who are they texting with? What websites are they going to? It's really, really important to keep those lines of communication open. And then also, just like as we tell parents when you have children going to other homes, asking them if they have guns in the home, you want to know, what is that family's internet policy like? Because as they get older and they're visiting families, your home rules may not apply, and they may have the ability to interact with people online or do things online at a friend's house that you wouldn't allow in your home. So that communication between parents is also really, really important. And then also communicating with the school, because we know kids talk in school, and you want to know what's happening there, and making sure the school is engaged with parents in those conversations, and that parents are consistently helping keep kids safe at home.
Yeah, I can tell you as the father of who now a 23-year-old young lady, managing the technology growing up was probably the most difficult piece of that. Dr. Turkovich and Dr. Ashraf, do you see eating disorders sometimes play a role in this? When somebody has a problem, you see the change in their eating pattern, but sometimes even in anorexia?
Oh, 100%. Yeah. So that can definitely be a manifestation of a child's trauma, developing an eating disorder or other kind of restrictive or unhealthy eating habits. It's definitely a complex issue and a complex way to that they are dealing with their trauma, but it's definitely a manifestation of potential history of abuse.
Rebecca, let's talk about the Enough Abuse campaign. What is that?
The Enough Abuse campaign goes into a lot of what Dr. Turkovich was talking about. Aaron's Law was passed in New York State about 2 years ago, requiring children in schools to get child abuse prevention education. So the Child Advocacy Center uses the Enough Abuse campaign to provide that education. So the goal is really teaching children about their bodies, safe ways to talk about with their parents, about what's happened to them. If they're experiencing abuse, how to tell somebody about it, who is a safe person in their life, but also teaching teachers warning signs about noticing those behaviors that Dr. Turkovich was talking about, how they can be safe people for the children to disclose to. We provide that at the Child Advocacy Center free of service to the community. So if there's any schools out there that need it, please feel free to give us a call.
The teachers are really on the front lines of so much.
Absolutely.
You know, what happens in the home manifests itself in the classroom, from sometimes nutrition and now finding this. It's a lot to ask the teacher. Do they get training, and do others, can a parent get kind of a training in this?
That's a fabulous question. The Enough Abuse campaign does that as well. Our goal is really in creating a safe community around these kids. Kids spend almost like a full-time job every week in the schools. So we teach the teachers, we teach the school bus drivers, we teach the cafeteria workers, and we teach the families, ideally, about how to talk to their kids about child abuse and what to do if they suspect it's happening.
And speaking of the suspicion that it's happening, Dr. Ashraf, we talked about some of the signs, you know, that a child who's being maltreated, what they may exhibit. You may want to elaborate on that. But as an adult, an educator, a caregiver, if they suspect something's happening, like we mentioned in the classroom or in the neighborhood or in the home, is the adult obligated to report this, and who do they report it to?
We did discuss some of the signs and symptoms of a child who's potentially being maltreated. So we could see bruises on parts of the body where a child typically would not bruise during regular play. Any bruising anywhere on the body of a non-mobile infant. Burns or bruises that follow a pattern. Children may exhibit behavioral changes like becoming withdrawn, increased aggression, acting out, nightmares, things like that, night terrors. Children may have stooling or urine accidents. They may exhibit sexualized behaviors or sexualized play. If an adult is a mandated reporter, so there's a list of mandated reporters in New York State available on the Office of Child and Family Services website. But so that would include people like teachers, like we just talked about, daycare teachers, babysitters, medical providers. So if they suspect that a child is being maltreated, they are required by law to report their suspicion to the New York State Central Registry. If a non-mandated reporter, so that would be an adult in the community, a neighbor, for example, suspects a child is being maltreated, they should also report this to the New York State Central Registry, because it's really the right thing to do to ensure the child is safe. And it's important to remember that those who report to the New York State Central Registry, they do not need to have proof that abuse or neglect has occurred. They just need to have a suspicion, and they need to report that suspicion.
Lieutenant Mann, you've had years' experience with all of this, and one center that you were involved in, are currently still involved in, is the Family Justice Center. And there are a lot of similarities between the Child Advocacy Center and the Family Justice Center, in the sense that you want to create this environment. And in the case of the Family Justice Center, it's domestic violence, but there are some crossovers.
There are, first of all, crossovers between the two issues in life and in our investigations. And actually, the community effort to establish the Family Justice Center in our community really came out of our success in dealing with child abuse issues at the Child Advocacy Center. And the early conversations were among the team and eventually brought to the Erie County Coalition Against Family Violence and the Erie County Commission on the Status of Women. And together they did a community-wide effort that ultimately led to founding the Family Justice Center. But it's the same conversation that we had about a team response within the hospital, a team response within our investigations and within the community. It really takes all of us working together so that victims don't have to go to 5 or 10 different places to get the help that they need.
And I know at the Family Justice Center, maybe the same is true at the CAC, it's a bit of a safe haven. So somebody that is involved in a domestic violence, they can go there and feel like somebody's not going to come and get them.
Yeah, of course. And the major difference is, with child abuse cases, there are mandated reporters and actions that child protective services can take in the interest of the child. Whereas with domestic violence and intimate partner violence, you're dealing with adults. And adults often aren't sure what they want to do because human relationships are complicated. So the Family Justice Center is a place that they can go to sort out what they want to do, whether to go to family court or through criminal court or whatever. But the importance of that is that whatever they choose is available to them in one facility.
Dr. Turkovich, what role will Oishei Children's Hospital play with this new CAC? It's certainly going to be within a snowball's distance of you, and how's that going to help our entire community, and how will you interact with it?
So we're going to continue to have a medical clinic, in essence, embedded in the CAC. The secret to success of a CAC, as we've talked about, is the integrated team that is there. So we play the role of the medical team with Dr. Ashraf and her team, focusing on medical exams, understanding patterns of abuse, linking patients and families with services, whether they be CPS services and safety, working with the Family Justice Center, social work, forensic interviews, and things like that. So that is actually an Oishei team that's embedded in the CAC. We hope to expand our ability to see more patients there by adding an additional exam room, expand our team of providers there so that we can serve all children who have been victims of abuse or suspected victims of abuse, and make sure that they have access to all of the services that are embedded in the CAC. We also do a lot of outreach and education of community pediatricians so that they understand what's their avenue into the CAC when a patient or a child or family were to disclose to them. So it's a lot about building those bridges and linkages, both with the lay public, but also with the medical community, to make sure that whatever doorway a patient or family has into the system, quote unquote, we make sure that it's seamless from there on out.
A lot of moving parts here, Rebecca, for the medical team and the mental health evaluators. And when do we anticipate this new CAC to be in place, and what does the public need to do to help move this forward?
That's a great question. We're very excited. There's actually work that's been started. Construction has started on the new building. We anticipate it opening in spring of '24. And now that I've said that, I hope that stays accurate with construction. We're in the process of raising about $10.5 million. We're over halfway there. So if the community has any questions, they can go to cacbuffalo.org and check out how they can volunteer or hold a fundraiser or just be involved in any way.
And donate.
And donate.
Yeah. I would think that in this case, people would see this and say, wow, we're helping families and children. This is good. Just as we do fundraisers for Oishei Children's Hospital, this is a bit of an extension on that, because you are still helping children. It's in a different way, but helping them get through a terrible trauma.
We're really hoping that the community buys into this as being a community issue. This can happen in your home. It doesn't discriminate. It can happen to your neighbor. And we want Buffalo and our community to be healthy and safe children help the next generation be safe.
Yeah. Folks, if there's anything you need to do, you need to watch the screen that's coming up. I'm going to give you some information. If you think that there's something happening in your family, if you think that there's somebody in your neighborhood or a child that is in need, we're going to have some important phone numbers for you to write down and some websites as well. We thank you for joining us on this special edition of our Community Conversation, Your Hometown Health Connection, brought to you by Buffalo Healthy Living Magazine. We want you to get a pen and paper, write down some of these phone numbers and websites. You may find them to be very helpful. And as we said, if you see something, say something. If you need to see emotional and informational videos, you need to go to enoughabuse.org. The Child Abuse Campaign Training, you can contact Megan Dudziak, Education and Outreach Coordinator, to schedule a training for your organization. Here's an email, mdudziak@bestselfwny.org, or you can call 716-886-5437, extension 567. To donate to help build that new Child Advocacy Center, you can make a donation by sending a check to the Best Self Foundation, 255 Delaware Avenue in Buffalo. The zip is 14202. And you can designate your donation to the Child Advocacy Center at Best Self. And you can also download a donation form at this website, cacbuffalo.org/make-a-donation. Very important to report child abuse. If a child is in immediate danger, you need to call 911. There's a child abuse hotline for New York State. It's 800-342-3720. There's also a mandated reporter hotline in New York State. This number is 800-635-1522. And trafficking and exploitation, that hotline is 315-218-1966. You can contact the Child Advocacy Center. They're at 556 Franklin Street in Buffalo. Phone there is 716-886-5437. And there's an email, cacinfo@bestselfwny.org. Now, there are more links and videos and all of this contact information that I just gave you. We're going to present that on our website, which is WBBZ-TV, and it'll be there for a while. We want to thank Annette Pinder at Buffalo Healthy Living Magazine for producing these important community conversations with our participating sponsors. Thanks for watching. Be safe and be well. This special edition of your hometown Health Connection Community Conversations, Heal, Talk, Act, was presented by Buffalo Healthy Living Magazine with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, Best Self Behavioral Health, and WBBZ-TV.
Being your best self starts with mental health. Whatever struggles you're facing, Best Self is here to help. But the smallest voices need the most help being heard. Children, who are the most vulnerable, can't always speak up for themselves. Getting help early is crucial before it has a lasting impact on their lives. 1 out of 10 children will be sexually abused before they reach age 18. And we can't stop it if we don't talk about it. Donate to Best Self's Child Advocacy Center at cacbuffalo.org.